Hello, I'm Jackie Fox, and welcome to Fox Talks. Today, I would like to talk to you about abortion. I would like to start by saying that I'm not pro abortion, I'm pro choice. I wish that we lived in a world where people rarely needed to get an abortion, but also I accept that that's not the world we live in. So today, I'm going to show you the reasons why people might need an abortion, how people are trying to change the laws around abortion, and why abortion isn't such a bad thing after all. As a disclaimer, I'm going to use the word woman or women a lot in this essay, but men can have abortions too, so long as that man has a functioning womb. But first, we have to ask the question, why do women get abortions? According to a 2004 study of 1,209 women who'd had abortions, the reasons most frequently cited were that having a child would interfere with a woman's education, work, or ability to care for dependents, with 74% reporting that she could not afford a baby right now, 73% reported that, and that she did not want to be a single mother or was having relationship problems, 48% of women reported that. Nearly 4 in 10 said that they had completed their childbearing, and almost 1/3 were not ready to have a child at all. Fewer than 1% said their parents or partners' desire for them to have an abortion was the important reason. Young women often reported that they were unprepared for the transition to motherhood, while older women regularly cited their responsibility to their current dependents. Even without counting time missed by work, pregnancy is expensive, easily costing over $30,000 when you include prenatal care. Even if your argument is that they should have the child, but put it up for adoption instead of having an abortion, this alone is an unfair burden to place on an unwilling mother. It can also be a strain on marriages, many of which end over financial considerations. On the other hand, though, abortions aren't typically expensive, averaging around $500, especially if we're talking about something like the morning after pill, which is even less expensive. Not to mention the incredible burden of carrying a child for 9 months, in addition to the consequences that can have all by itself for a woman's health. But there's one more important reason that women might not want to have a child, and that's the maternal mortality rate. For one, pregnancy is a serious medical concern that ends the lives of numerous women each year. I didn't know how big of a deal this was until I watched a Philip DeFranco deep dive on the subject, and I'll include a link to that in the description if you'd like to see that as well. NPR also did a great series of stories on maternal mortality. Hakuna Matata. I feel like this is going to happen a lot during this video. NPR also did a great series of stories on maternal mortality, which I will link to in the description. More American women are dying of pregnancy-related complications than any other developed country. Only in the US has the rate of women who die been rising. Though according to the National Institute of Health, this may be because of previous poor reporting standards, which suggests that it was always this high. We just didn't know it. A sign that this might be the case is Texas, whose numbers jumped tremendously in 2011 and 2012. This is because death certificates didn't previously have a question about pregnancies in the last 12 months, and therefore missed many births that were caused by complications of pregnancy that happened well after childbirth. Each year, between 700 and 1,000 or more women will die before, during, or after childbirth due to complications. Of all the deaths related to pregnancy in the United States, nearly 31% happened during pregnancy, 36% happened during the delivery or the first week after, and 33% happened 1 week to 1 year after delivery. 3/5 of these deaths are considered to be preventable. African American women are 4 times as likely to suffer from maternal morbidity and mortality than Caucasian women. Black women did not have a significantly greater prevalence rates of the conditions above than white women. However, black women with these conditions were 2 to 3 times more likely to die from them than were white women, due to differences in how they were treated. A bill introduced in Ohio got a lot of attention not because it sought to ban insurance coverage for abortion, as well as birth control that can prevent the implantation of fertilized eggs, but because it included a provision for the coverage of an impossible alternative. State Representative John Becker included an allowance for insurance companies to reimburse patients for a procedure for an ectopic pregnancy that is intended to reimplant the fertilized ovum into the pregnant woman's uterus. Even though there is no existing medical procedure that moves a fertilized egg or growing embryo from one part of the body to another. An ectopic pregnancy is one where the fertilized egg implants and starts growing somewhere other than the uterus. In 95% of cases, the implantation occurs in the fallopian tube, which will rupture within weeks, potentially killing the patient, without the intervention of an abortion. In extremely rare cases, the egg can implant somewhere in the abdomen, where there is more room to grow. There have only been a handful of studies of surviving babies and mothers under these circumstances, but death for one or more parties is far likelier than any other outcome. The placenta, which is the organ that provides blood to the growing fetus, can only provide sufficient nourishment by attaching to other organs. The uterus is designed to withstand this. Other vital organs, however, are not. According to a study in the United States, there is an estimated 10.9 abdominal pregnancies per 100,000 live births and 9.2 per 1,000 ectopic pregnancies. The mortality rate was 5.1 per 1,000 cases. Although the risk of having an ectopic pregnancy is rising, the rise of abdominal pregnancy, which is probably always a sequel of a missed ruptured ectopic pregnancy, is apparently declining. This may be due to improved prenatal care. However, only 1 in 9 women who reached the hospital alive had an accurate preoperative diagnosis of abdominal pregnancy. Using annual abortion numbers and the U.S. mortality rate, as well as the rate of health complications reported as the reasons for abortion, if all abortions between 2010 and now had been prevented, between 3,000 and 4,000 more women would have died of complications involving childbirth over those 9 years alone. Another major issue is the lack of contraception. Thanks to the Affordable Care Act, insurance plans are no longer allowed to exclude contraception. However, many Americans can't afford health insurance. For women of childbearing age, health insurance costs between just over $2,000 a year to over $3,600 a year on average, a cost that, like a child, many can't afford. Of the 66 million women of reproductive age living in the United States, more than 20 million are in need of publicly funded contraception. Among that 20 million, 19.5 million currently live in contraceptive deserts. That is, they lack reasonable access in their county to a health center that offers a full range of contraceptive methods. Who's trying to ban safe and legal abortions? Now that we know a bit more about the topic, let's look at the bills that senators around the country are trying to pass into law. A lot of state legislatures are proposing bills related to abortions, so many that they wouldn't all fit in a single screenshot. Alabama legislators passed a bill banning abortions with very limited exceptions to avoid a serious health risk to the unborn child's mother, or if the unborn child has a lethal anomaly, and if the woman has an ectopic pregnancy. Mississippi Governor Phil Bryant signed a heartbeat bill in March. Exceptions are to prevent a woman's death or her serious risk of impairment. Ohio Governor Mike DeWine signed into law a heartbeat bill in April, a day after the state House and Senate passed the law. Similar legislation was vetoed by former Governor John Kasich before he left office. Georgia Governor Brian Kemp signed a bill last week that would ban abortions if a fetal heartbeat can be detected. The American Civil Liberties Union said it will challenge the law in court. Georgia also has the highest maternal mortality rate in the United States at 46.2 for every 100,000 women. Kentucky passed a heartbeat bill in March, but a federal judge stopped it from being enforced. Arkansas Governor Asa Hutchinson signed a bill in March that bans abortions after 18 weeks of pregnancy, 6 weeks before the standard set by Roe v. Wade, except in cases of medical emergencies or in cases of rape or incest. Arkansas has the 5th worst maternal mortality rate in the United States. Utah similarly passed a bill that bans abortions after 18 weeks of gestation, but the bill was blocked by a federal judge. Missouri, which has the 7th highest maternal mortality rate, South Carolina, Louisiana, which has the 2nd highest maternal mortality rate, West Virginia, Texas, which has the 6th highest maternal mortality rate, and Florida are also considering these bills in the meantime. So let's talk about issues with heartbeat bills. A lot of these bills would ban abortions after a heartbeat can be detected, which typically would mean about 6 weeks after conception. The type of abortion ban has several inherent problems. Some reproductive rights argue that the term heartbeat bill is a misnomer, since the fetus does not yet have a heart at 6 weeks gestation. The cardiac activity detectable at that time comes from the tissue called the fetal pole. People are dying because of the maternal health here in Georgia, says Dr. Crystal Redmond, the executive director of Spark Reproductive Justice Now. The fact that we're eliminating a healthcare option, a service, will do a disservice to Georgians, especially Black, queer, and low-income people who are disproportionately likely to see abortion care. It's basically a forced pregnancy bill. It's a healthcare ban bill, she adds. The Georgia bill doesn't include language explicitly exempting women who terminate their own pregnancies from the penalties meant to apply to doctors. The bill was set up thinking you would have some sort of a physician person, either providing a pregnant person with medicine or some medication or doing a surgical abortion, she said. It doesn't seem to take into account necessarily what happens if the patient self-manages an abortion. This could potentially lead to miscarriages being investigated as crimes that could result in a maximum of 10 years in jail for the mother. Another issue is that no method of contraception is 100% effective, except for total abstinence. The most effective methods, short of surgical sterilization, are hormonal implants, intrauterine devices. Each of these devices will fail in some circumstances, and no amount of responsibility or diligence excludes a sexually active person from the risk of pregnancy, though obviously this doesn't apply to all people, all couples, or all types of sexual intercourse. Another issue is that doctors track gestation starting on the first day of their patient's last normal menstrual period, but conception isn't actually possible at that time. Conception occurs only in the 12 to 24 hours after ovulation, when the ovary releases an egg, usually about 14 days after the first day of the menstrual cycle. So, somewhat confusingly, a person is likely on their second week to be on their second week of pregnancy at the moment they become pregnant. This means most pregnant people would only have 4 weeks after conception to realize that they're pregnant, decide to seek termination, and acquire a termination. 4 weeks may sound like a long time still, but the ability to know you're pregnant doesn't begin immediately at conception. The most sensitive at-home pregnancy tests are effective only about 4 or 5 days before your next period should start. Menstrual cycles vary, but that means that many people will be, as far as the doctor is concerned, about 3 weeks pregnant at the time that a test could first reveal their condition. Tests are also most reliable after your missed period would have started, at which point you may be 4 weeks pregnant. Many individuals who have no reason to suspect a pregnancy will not think to take a test on the first day of their missed period. Menstrual cycles vary in many people for many reasons, and some methods of birth control can make periods stop entirely. If it is not unusual for your cycle to vary in length by a couple of days, you may find yourself in your 5th week of pregnancy before deeming it later than usual. While some signs of pregnancy can appear during this time, many of those early symptoms are identical to those experienced right before a period, including cramping, light bleeding, which could delay suspicions of pregnancy even further instead of prompting you to take the test. Abortion's legacy and the decline in crime. In addition to significantly reducing financial burdens on sexually active women and reducing their likelihood of death from complications of pregnancy, there also seems to be evidence that legal abortions reduce rates of crime. Why? I'll let Ben Shapiro explain.
That most of the gun violence in this country is committed by young men aged 16 to 25, men who come from predominantly single mother backgrounds, who have poor levels of education, who grew up in poverty. Those would be good weighing factors.
Thanks, Ben. He wasn't talking about abortion in that clip, sure. He was blaming black people for gun crime. But that's close enough for a YouTube video. Right, Ben? In a 2001 study, John Donahue and Stephen Levitt shocked the world by offering evidence that legalized abortions had contributed significantly to recent crime reductions. Crime began to fall roughly 18 years after abortion legalization. The 5 states that allowed abortion in 1970 experienced decline earlier than the rest of the nation, which legalized in 1973 with Roe v. Wade. States with higher abortion rates in the 1970s and 1980s experienced greater crime reductions than the 1990s. In high abortion states, only arrests of those born after abortion legalization fall relative to low abortion states. According to their study, legalized abortion appears to account for as much as 50% of the recent drop in crime. This strong correlation was evidenced in rates of violent crime, property crime, and murder. Key findings of the study include, as I mentioned before, the 5 states that legalized abortion 3 years before Roe v. Wade, crime started falling 3 years earlier in those states. And property crime, which is often done more by young people, falling even before violent crime. After abortion was legalized, the availability of abortions differed dramatically across states. In some states like North Dakota and in parts of the Deep South, it was virtually impossible to get an abortion even after Roe v. Wade. If one compares states that had high abortion rates in the mid-70s to states that had low abortion rates in the mid-70s, you start to see the following patterns with crime. For the period between 1973 and 1988, 2 sets of states, high abortion states and low abortion states, had nearly identical crime patterns. Note that this is a period before generations exposed to legalized abortion are old enough to do much crime. This is exactly what the Donahue-Levitt theory predicts. But from the period of 1985 to 1997, when the post-Roe cohort is reaching peak crime ages, the high abortion states see a decline in crime of 30% relative to low abortion states. The original data ended in 1997. If one updated the study, though, the results would be similar. All of the decline in crime happened between 1985 and 1997, experienced by high abortion states relative to low abortion states, is concentrated among the age groups born after Roe v. Wade. For people born before abortion legalization, there's no difference in crime patterns for high abortion and low abortion states, just as the theory predicts. When we compare arrest rates of people born in the same state, just before and just after abortion legalization, you can once again see the identical pattern of lower arrest rates for those born after legalization than before. The evidence from Canada, Australia, and Romania also supports the hypothesis that abortion reduces crime. Studies have shown a reduction in infanticide, teenage drug use, and teenage childbearing consistent with the theory that abortion will reduce other social ills similar to crime. The paper concluded with a strong out-of-sample prediction regarding the next 2 decades. When a steady state is reached roughly 20 years from now, the impact of abortion will be roughly twice as great as the impact felt so far. Our results suggest that all things equal, legalized abortion will account for persistent declines of 1% a year in crime over the next 2 decades. In a follow-up study released in May of 2019, they released a study covering the last 2 decades of time between studies. They found strong support for the prediction made in their earlier paper. The estimated coefficient on legalized abortion is actually larger in the latter period than it was in the initial data set for almost all specifications. They estimate that crime fell roughly 20% between 1997 and 2014 due to legalized abortion. The cumulative impact of legalized abortion on crime is roughly 45%, amounting for a very substantial portion of the roughly 50 to 55% overall decline from the peak of crime in the early 1990s. So what can we do? What can we do to reduce abortions in the United States without triggering all of these ill effects? The first thing we would do is provide publicly funded contraception to the 20 million women of childbearing age in the United States, and working to end the so-called contraception deserts that they live in. Another thing would be to provide better pre- and postnatal care. Both of those issues could be solved with a good, low-cost public health system, like the Medicare for All championed by many Democratic presidential candidates. With around 60% of pregnancies-related deaths being preventable, a rate that's even higher among women of color, there seems to be considerable room for improvement with proper pre- and postnatal care. It may also help to cut back on the trend towards unnecessary C-sections, which contribute greatly to the maternal mortality rate. Solving these problems would significantly reduce death rates among young women, as well as reducing the number of abortions that are necessary by women who aren't ready or willing to have children. So, I hope you learned something. I learned a lot. I had heard of the Donahue-Levitt hypothesis probably like 5 or 10 years ago, and it's stuck in my head because it's almost shocking. And one of the things that I learned during making this video is that they had actually released a follow-up study just a few days before I started researching this, while the states were banning abortion. One thing that was kind of annoying, I wish I could have looked deeper into the data, but it is not currently available for free as far as I can tell. So, unfortunately, I could only look at basically the abstract of that study and draw conclusions from that. But I would really actually like to see the whole study now that I've done all this research into it. So if you would like to see the growth of my channel from a 6-week-old fetus that has a heartbeat coming from its fetal pole, please hit that like button. It really helps the channel grow in the algorithm. If you would like to see more deep dives like this, hit that subscribe button, definitely. Tell me what you think in the comments. Share personal stories or just, I don't know, do whatever, because that helps the channel grow as well. And maybe someday we'll have a fully grown news service that can provide this kind of information more often and with even more depth. And also give me the ability to actually purchase some of these cutting-edge studies that I'm seeing. Another way that you could help me do that is by hitting the Patreon link in the description. But all that being said, I'm glad you learned something. And another thing that we can definitely do together is stand up for each other in solidarity. And if you hear about an abortion-related protest happening near you, especially if you're in one of the states that is trying to propose this legislation or has recently passed it, consider showing up. You don't have to bring a sign. There's probably going to be someone there handing out generic signs. You can grab one of those. Just get yourself there. Stand up and let your voice be heard.
Boy, these conservatives are really something, aren't they? They're all in favor of the unborn. They will do anything for the unborn. But once you're born, you're on your own. Pro-life conservatives are obsessed with the fetus from conception to 9 months. After that, they don't want to know about you. They don't want to hear from you. No, nothing. No neonatal care, no daycare, no Head Start, no school lunch, no food stamps, no welfare, no nothing. If you're pre-born, you're fine. If you're preschool, you're fucked.